So thank you for coming along. I've been joined by the Acting Chief Health Officer, Professor Ben Cowie, and the COVID Commander, Jerome Weinmar, to update the community on the current state of the pandemic in Victoria. So there were a number of 324 cases locally acquired yesterday, reported of COVID-19. And there was one case in hotel quarantine. 107 of those cases are linked to known outbreaks and cases, and the rest are under active investigation. This takes us now to some 2,166 active cases, all except 5 of those are locally acquired. This continues to be an outbreak of the young and disproportionately the young and the unvaccinated, and the figures continue to reflect that. Some 317 cases are between the ages of 0 and 9. 337 cases are between the ages of 10 and 19. 556 cases are aged in their 20s and 365 in their 30s. 87% of all of the cases that are active in the state are aged under the age of 50. There are 111 people in hospital in Victoria. 32 of those are in intensive care and 19 of those are on a ventilator. There were 37,604 vaccines delivered through the state-run clinics yesterday, another impressive daily record for those state-run centres, and I want to thank those 37,604 Victorians, but equally the hard-working staff in those state vaccination centres. There were also 54,242 COVID-19 tests returned yesterday, and well into the high 90% of those were turned around within the next day. So of the 111 Victorians currently in hospital yesterday, 89% of them were not vaccinated at all. 11% were partially vaccinated with a single vaccine. And we had no one in hospital who had been fully vaccinated. I just wanted to touch on a particular case in an aged care facility in Gladstone Park. We were notified late yesterday of an aged care facility in Gladstone Park where the large majority of residents and staff have been tested, and in addition to the one case of a worker there, that no one else has yet returned a positive result. Pleasingly, some 90% of the residents at the facility are vaccinated, and even more pleasingly, 100% of the staff were vaccinated, including the positive case. It's really excellent to see that what works when that high coverage is in place. We've still got to run those tests down, but we all know only too well from 2020 what the impact of coronavirus can be in our aged care settings. And it's important, therefore, to remind anyone in the aged care sector that if you haven't been vaccinated, you need to do so, because it is now written into the public health orders that as of the 17th of September, vaccinations are required for all aged care workers in regards to applying the National Cabinet decision from some months ago, a decision that all states and territories have supported and one which Victoria very strongly supports. In regards to the state's own aged care delivery services, the state residential aged care services, more than 90% of residents have had at least one dose, and those who have declined or have had people decline it for them, we continue to approach them to make sure that they have the safety and the protection of being vaccinated. Over 86% of the public sector aged care staff have also had their first dose, which they will need to have if they are to stay at work past the 17th. Victoria's public residential aged care services have been leading the way in delivering on the National Cabinet decision here, and many of our facilities have for some time hit 100% staff vaccination levels right across the state, from Apollo Bay, Beaufort, Birchip, Burwood, Camperdown, Lorne, Donald, Shepparton. From one end of the state to the other, the state residential aged care services have been leading the way. We've just got to mop up those last few, and now that it's in the public health orders and is required as a condition for coming to work, we're confident that that will make sure that that's mopped up. In regards to the entire, both public and private and not-for-profit residential aged care system in Victoria, it's pleasing to note that 82% of the workforce overall has had their first dose, and we would encourage the remaining sector, the remaining parts of the sector, to use the intervening period and the priority status that the workforce has to get vaccinated. It is so important. I also wanted to briefly touch on a trial that our friends at the Royal Children's Hospital have put in place for COVID testing devices for young people, for kids. We know that medical tests can sometimes be disconcerting for young children, but with 317 active cases with children aged under 10, we know that testing is really important tool to make sure that we protect those kids. There's a new trial through a Rhino Med Junior trial program that the Royal Children's are now putting in place. It's a much less invasive but equally accurate test that has a control device that the child themselves use that sits at the base of their nose and collects any virus particles for testing. It comes in a range of designs and applications that can also hopefully make the process a whole lot less stressful for the kids. That trial will run over the next couple of weeks and is aimed at young people between the ages of 4 and 18, and will further add to the armoury of the public health team in making sure that testing and support for kids is at the heart of our public health response. Finally, due to the risks that continue to be posed by the movement of the virus across New South Wales, and that what that poses to a number of states, including Victoria, we are further tightening the border requirement restrictions as they apply to specified worker groups for multiple entry permits. As of the 23rd of September, freight and healthcare workers entering Victoria under those specified multiple entry work permits must have had at least one vaccination dose before entering Victoria. The evidence from the documentation of the first dose of the COVID-19 digital certificate will be one of the preferred methods, and that will, I suspect, increasingly become a tool as proof of vaccination status becomes an important part of the nation's approach to managing the transmission of the virus and getting us back towards a more open and successful community. I might ask the Acting Chief Health Officer, Professor Coward, to say a few words. Then Jerome will add to what the current outbreak circumstances look like, and then we're happy to take questions.
Thanks very much, Minister. So as Minister Foley just said, there were 37,604 vaccines administered by the state system in Victoria yesterday, breaking the previous record set the day before. And this is exactly what we need to see happening, not just in our state system, but across all those fantastic GPs and pharmacies who are vaccinating just as significant numbers, and we need that to lift up. So that makes for a total of 2.7 million doses administered through state-run centres since the vaccination program commenced. So we're at 63.2% of eligible Victorians having been vaccinated with their first dose, and that really is lifting significantly. Also reflecting on people making bookings for vaccination, 81,000 bookings were made in our system, both through the website and using our hotline yesterday. And we still have more than 7,000 available first dose AstraZeneca appointments over the next 7 days. So really record booking levels as well, and clearly the more doses of vaccine that are available, the more appointments that we can make. In terms of testing, 54,242 tests were processed yesterday, bringing the total number of tests processed during this outbreak to over 1.5 million. So this is a tremendous effort and testament to Victorians coming forward and doing what they need to do when they have the slightest of symptoms of COVID-19. But we can always do more. And with 324 cases reported in the 24 hours to midnight, we do need to see those testing numbers not just stay where they are, but increase. As the Minister was reflecting, this is not just about public health measures. It's so we can deliver healthcare to those individuals, keep them out of hospital and keep them out of intensive care. It really is so important. We know that there is widespread transmission continuing to occur, and of particular concern is the cases in the northern suburbs of Melbourne, which Jerome will speak to shortly. To make testing as easy as possible, we are extending the opening hours at 3 of our northern suburbs testing sites: the Sprint Pavilion in Craigieburn, the Roxburgh Park Recreation Centre, and the Keilor Park Basketball Stadium will all be open for testing from 8 a.m. till 8 p.m. Also important to note that the Melbourne Showgrounds testing site had wait times of no more than 15 minutes yesterday, and remains a great option for anyone in the northern and western suburbs. Getting a test is one of the reasons you can travel more than 5 kilometres from home. So do check out our website and find a site with lower wait times to make your testing as quick and easy as possible. As of this morning, we have also opened a truck testing site in Orbost, in addition to the 2 sites on the Hume Highway, one in Langwarry and one in Nil. This supports the road freight industry with more access to testing for drivers. Finally, today is Are You OK Day. A public health team, and indeed all of those of us involved in the COVID-19 response, we're all acutely aware that continued lockdowns are taking a toll on the community, and that strain is magnified as we see case numbers go up. So it's so important that today, like every day, that we are checking in on our friends and family. The simple question, are you okay, can start a powerful conversation which might make all the difference to a loved one's well-being. And of course, also please make sure that you're taking care of yourself. I'll hand over to Jerome now.
Thanks, Ben, and good morning. And can I also, on Are You OK Day, just extend my thanks to all those mental health professionals working out there at these really challenging times across our state, and everybody who's checking in on their mates, their families and their loved ones to make sure that they're doing okay, and to offer those kind words of support at some very challenging times for very many people. In terms of the cases today, 324 cases, a very challenging number indeed, and the pattern continues to be very similar to what we've seen really over the last 2 weeks. We have 102 cases in our western suburbs, including suburbs such as Werribee, Tarneet and Altona North. We have 195 of those new cases in our northern suburbs, including suburbs such as Craigieburn, Glenroy, Roxburgh Park and Broadmeadows. We have 5 cases in our eastern suburbs. We have 20 cases in the southeast, in locations such as Keysborough, Nair Warren and Hampton Park. And we have 2 cases in regional Victoria. Let me just talk to those briefly. We have a case in Shepparton, a primary close contact of a positive case we've known about. They're in isolation, we're not too concerned. And 1 case in Mitchellshire, a primary close contact of a case we identified yesterday. We have 1 further case that we're just trying to lock down the location for. That brings us up to our 324 locally acquired cases. The distribution of our active cases, again, are also quite similar. So over half of our active cases now are in our northern suburbs. Over a third of our active cases are in the western suburbs. And then really we have around 4.5% still primarily in the Shepparton area. Those are old cases that are coming to the end of their infectious period, and around 10% across the southeast and eastern suburbs of Melbourne. So we still see a very clearly defined picture, but we have, as Ben's explained, significant concerns around deep-seated community transmission, particularly in our northern and western suburbs. Just in terms of regional Victoria, now is it even more important than ever, particularly for regional Victorians, to really stay very closely on top of their symptoms and any potential exposure sites. I'm pleased to confirm we've had no further cases in Mildura following the positive case identified yesterday, and no further positive cases identified in the Bellarine. And the Latrobe Valley case that we reported yesterday on the second test had a negative test. That individual has gone to our expert review panel, and hopefully we'll report back on that in the next day or 2. There are 3 sort of locations or 3 particular examples I just want to give. The aged care facility we mentioned yesterday in Moonee Ponds, where we have a staff member who had been fully vaccinated who was a positive case. Please confirm with 105 out of 106 residents have all reported negative test results. We're awaiting 1 more test result, and all staff results back so far are also all negative. And the aged care facility in Gladstone Park that the Minister just referred to, again, a staff member who had been fully vaccinated. Of the 64 residents, 60 have returned a negative test result, and over 40 of the 50 staff have also returned a negative test result. Obviously, those facilities remain in lockdown and we'll continue to support them as we normally do. But it highlights again how strong PPE arrangements, strong controls at those facilities, and of course the vaccination coverage of residents and staff, how important that is in stopping that onward transmission in these most critical locations. We still have a bit of a theme around construction. So one of our CBD construction sites has had a further 2 cases today, taking up to a total of 8 active cases on multiple floors of that large office refurbishment, 89 primary close contacts at this point in time. I expect those numbers to continue to rise in the next few days. And again, can I please again encourage, particularly those working on construction sites, I mentioned this a few days ago, it continues to be an area of significant concern. With the levels of community transmission we're now seeing across many of our suburbs, it is so important that we have outstanding controls in place at every single work site that is still operating. Without that, what we will see is transmission. We've been fortunate so far in this outbreak that we haven't seen widespread transmission at essential work sites. We really need to ensure we don't get into that territory in the days and weeks ahead. I've mentioned, and Ben's mentioned, significant community transmission now in our northern and western suburbs, and we are really starting to surge significant state and local resources into particularly the western suburbs and the northern suburbs. And can I give a huge shout out and thanks to our partners in the local councils, in community and primary health, in all other agencies of government around the outstanding support and cooperation we're getting at the local community level. We are now combining and building stronger partnerships than ever before in order to support people in those communities in situ, to ensure that people who need that extra help can get it where they are, and that we minimise unnecessary movement in those areas. That is a huge programme of work. We'll continue to talk about that in the days ahead. I can also thank the many community and civic leaders who are actively involved in that programme. Every single day of the week, we are having virtual or real meetings with people who are passionate about their communities and passionate about protecting their communities and giving them the support that they need. And can I say, please, both through the local leaders and through anybody who's listening, we are there to support you. We are there to support those people who are concerned about their health and who want to check in on their status and who need that extra help to isolate safely and to avoid passing coronavirus on to the rest of their loved ones. We are still, even as late as yesterday, finding cases where entire households are positive when the very first person has come forward to get tested, and where adjoining households and families are all positive at the same time, not only indicating that we've seen some level of household-to-household contact, but far more worryingly that coronaviruses have been in those situations for a number of days, possibly as many as a number of weeks. That makes it so much harder for everybody to track down, and that is why we're seeing this rapid escalation of numbers, because as we're picking up new cases, there's a lot of cases sitting behind them who've already become infected over many, many days before. So please, again, my message as always is please get tested as early as you can. If you're concerned about anybody in your circle, in your friendship, amongst your workmates, encourage them to get tested. It's so important that we find a way of stopping it and not letting it get to others who you love. Finally, in terms of ongoing work, again, my message to employers and those people using our wider community facilities. If I look at workplaces and exposure site, a third of them are supermarkets because we all have to go and get our food. A third of them are smaller community retail hubs, and a third are construction sites. They are the few remaining places where we are still seeing significant people at play. If you're in those environments, please be very mindful. Be very mindful that we're now in an environment where there is widespread community transmission. That person next to you at the grocery aisle may be positive, and they may not know it. They may not be showing any symptoms, but we're seeing transmission in that environment. The people you're talking to in your local neighbourhood store may also have been exposed. We don't know that. You need to please ensure, protect yourself, protect them from you and you from them. And similarly, and again at workplaces, encourage everybody, please, to adopt those safe practices so we can stop this thing and stop it from going down those trajectories that we saw yesterday. With that, I'll hand back to the Minister for any further questions.
Thanks, Jerome. Happy to take questions.
And then, Minister, just on those northern suburbs, what are some of the measures that we're going to see in terms of getting vaccinations to people's doorstops, and when will we see that?
So in the north and the west, this trajectory had been identified by the local public health units in engagement with GPs and others on the ground for some time. And we've now, for some time, been putting in over half of our available vaccines into the north and the west. And that has meant disproportionately shifting from the state-run centres elsewhere in the state into the north and the west, and we've seen the figures of uptake of the vaccines reflect that. Equally, we know that targeting the risky communities that need the highest priority, whether it be faith communities, whether it be different groups, we've had a number of pop-ups in Islander faith locations, in Greek Orthodox locations, in Lebanese community locations, in Islamic mosques and other community-based and faith-based services. We know, however, that more has to be done because, as all of those testings and vaccines have demonstrated, we're revealing quite large, particularly large households and family contacts, increasing numbers of cases. So I did see today a GP and other community leaders call for more vaccines. We will be doing all we can within our available stocks to reprioritise even more vaccines, but we would also clearly support the call for the Commonwealth to deliver as much as it possibly can into the north and the west. I think what we are seeing now is a recognition of just the level of seriousness of the outbreak in the north and the west, growing faster in the north, and I'm thinking that the more vaccines we can get, the more delivery points we can get at a postcode level, at a trusted locations community level, schools, community health centres, etc. That's really important. But equally important are those GPs and primary healthcare networks that are embedded in those communities that represent and are faithful to the needs of their community, getting more support as well. So I strongly support the call that's been made today from those health and civic leaders to get more vaccines into those communities.
Minister, the Premier has said before that he wouldn't hesitate to get a van at the end of people's streets and get them vaccinated that way. Is that something that you're looking at doing?
Of course it is. We've already got quite a number of mobile facilities out there, and we're looking at doing more. But we've got to have first those trusted voices in the community, which they are now increasingly doing so, calling upon their networks, their particular family groups, their faith communities, their sporting communities, their women's groups, their workmates to come and get tested and to come and get vaccinated. And we've got to provide as many points of opportunity for that to happen as we possibly can. And increasingly, some of those will be mobile facilities. Clearly, mobile facilities, you can't do as much as you can in a fixed location. So we're looking at school locations, more faith-based other areas, but particularly we want to see more of the deeply embedded GPs in their community getting more support for vaccine provisions as well.
Have there been any developments since a couple of weeks ago, Minister, where we were talking about financial assistance for GPs to become part of the program to kind of subsidise them?
Yes, so we've got a trial project in Hobson's Bay where, through the leadership of Mukesh Harkawal and a group of other GPs who have come together to, at scale, bring forward that GP presence and pool their resources. We've provided them, out of the redirected stock that the state has, some further vaccines. And even though it's theoretically the Commonwealth's financial responsibility, we've contributed some financial resources so as to allow them to go up to scale. We hope, well, we know that that is being successful, and we hope that that can convince the Commonwealth, whose responsibility it is to look after the primary health care delivery, and they are increasingly doing so. We hope that that will be a model that the Commonwealth will come in behind and fund.
So you hope that that model will be replicated by the Commonwealth in a wider scale across the state?
And equally, the support that's there for the community health organisations, who are also, particularly in the north and the west, really important sources of valued public health advice that have years of being embedded in the high-risk communities that are disproportionately underrepresented in the current vaccine levels and therefore overrepresented in the current infection arrangements. So we want to make sure that every possible point of engagement, whether it be the state clinics, the community health centres, the GPs, the mobile clinics, the pop-ups in particular locations, that we get as much as we can out there in the north and the west, and indeed over time the rest of the state, to get us to those targets as quickly as we possibly can, and therefore keep the steep growth that we've seen in infections over the last period as flat as we possibly can as we get to a situation where we can safely reopen.
What was your understanding as to why New South Wales skated so far ahead on GP-administered doses over the last 2 months? Did you just believe that the GPs were being brought on board to get out the additional one-off Pfizer doses that they were given over the last couple of months?
Look, I think General Fruin and the Commonwealth essentially laid this issue to rest yesterday with a recognition that, particularly through the GP network, that Sydney had New South Wales, but particularly Sydney, had a larger amount of GPs come on to the services to deliver vaccines, and as a result had a disproportionate allocation of available vaccines. It's happened.
You didn't know that before this week? How did
we
you
had
rationalise the increased administration?
Well, our public health teams and our data people follow the distribution and engage with the Commonwealth, asked a few questions and got a few answers. So now that's been rectified, it's time to move on.
What do you make of New South Wales's plans to reopen to people who are fully vaccinated once 70% of the population is fully vaccinated?
Well, I obviously haven't had a chance, I understand just coming in, that that's been announced by the New South Wales government in the last few minutes. I haven't had the chance to be briefed. But in terms of what our public health team are doing and advising, and how all of our engagement across business, civic society, community groups, clearly we are all signed up to the national plan. The national plan talks about some measures being able to be taken when we hit 70 double dose % of 16 and above at fully vaccinated, and then further measures at 80. Our approach, and I assume New South Wales' approach, has always been to take the public health advice as to where we are at when any particular set of measures can be taken. That's why, as of midnight tonight, we're able to take some careful, cautious measures in our regions. That same advice says it's time to enforce the arrangements in aged care, toughen up the border restrictions, make sure that particular groups must be at least single vaccinated, if not double vaccinated, to carry out various activities. All of those factors go into the step-by-step plan of making sure that when we hit those targets, we can take the sensible, safe measures that the national plan talks about to get us safely reopened.
Do you know in the regional areas if businesses and individuals are still able to claim certain payments now that they're opening, or are there payments that will now no longer apply in those areas?
Not the full details, because it's really an issue led by the Minister for Industry Support and the Treasurer, but my understanding is from statements that were made yesterday that a lot of those payments are automatic, and even though businesses will reopen, they will reopen with quite severe restrictions still, and that I don't have the exact details, but I know the general principle is that those automatic payments that are already in the system will continue. I'm sure we could get Minister Bakula's team to give you the specifics.
The hospitality industry, has unveiled its own roadmap.
Can you speak up?
The hospitality industry has today unveiled its own roadmap stating that pubs and restaurants must reopen at 80% first dose vaccinations. Would you consider a Caulfield Cup type freedom trial as proposed by these industry groups?
Well, we thank all industry sectors for their engagement, and we regularly have all sorts of engagements with lots of different industry sectors. In terms of plans and proposals put forward, we of course always look at them, but it is the public health advice and what is safe and sustainable to reopen that drives what we do. The last thing we want to do is have a flash in the pan reopening that then sees the situation get even worse in the outbreak and actually require us to take even more stern measures to get on top of the outbreaks. So in terms of that particular one, or any other constructive suggestion from any industry player, we of course look at them, but they all go through the lens of the public health advice.
It was reported that in the Australian last night that Kerry Chan's advice was to wait until 80 or 85% to take these measures that they're going to take at 70. Does that concern you and your public health team that it might exacerbate their outbreak?
Look, I can't speak for what advice is or isn't given in New South Wales. My focus is on Victoria and making sure that our public health advice is at the heart of all of the decisions that this government makes when it comes to how we deal with dealing with this really, really challenging Delta outbreak that we've got. The situation in New South Wales is different. We want to make sure that we don't get to that level. I think they're at over 1,100 people in hospital. We're at 111. They're at levels of case loads that we want to avoid. We want to make sure that the public health advice that we take is built around Victorian circumstances, and that's what we do. We wish New South Wales the best, and as I know they wish us the best in getting on top of this, and respectively delivering on the national plan to safely reopen.
Minister, just on case numbers, obviously today's numbers are quite shocking. Health experts have warned that cases could climb into 18,000 active cases by mid-October, with 800 potentially hospitalised. Are these a true indication, and can our hospitals cope with these numbers?
Yes, these were briefings that I think the Department of Health provided to many people yesterday about the backgrounding of just what are the challenges. That's why we've been building on the lessons of 2020 for some time, looking at international measures of what best practice looks like, particularly around responding to Delta, and building across the whole treatment plan how we respond. There's nothing more important than that early test for Delta, for coronavirus, but particularly Delta, if you have it. The sooner we know someone is positive, the better the treatment plan in the community can be. And the results internationally and indeed in Australia show if we get to you early, when you're positive, we can get better health outcomes for you. The longer you wait, the more at risk you are. So our COVID positive pathway plan starts in the community, starts at looking after you at home with our nurses, our GPs, our primary healthcare providers looking after you in that situation. If you deteriorate, then clearly the pathway into the hospital and the treatment there, and if you really deteriorate into ICU, is part of that COVID positive pathway plan. The commitment that we've made regarding the billions of dollars of investment allows us to scale up that. We've now activated beyond the initial 4 phased hospitals to bring more beds and, if necessary, ICU units into play. And we are always trying to stay ahead, but we know that what happens today in infection rates in about 10 to 14 days is going to play out in our hospital services. So making sure we build both those community supports, those hospital supports and those acute supports is critical to that pathway. And we can scale up quite readily. We'd rather not. We'd rather people get tested, follow the rules, get vaccinated as quickly as possible, and we flatten this out as soon as we can. But the reality is we are going to see numbers increase in the coming period, and we are building our capacity and our response accordingly.
So you're not concerned with hundreds of medical staff currently furloughed?
Absolutely, I'm concerned.
Obviously, Sydney's intensive care units are expecting to be overwhelmed. Do you think we'll get to that state?
I'm concerned every day when the numbers of infections go up, but we know that they are projected to go up. That is why that concern has to be translated into programs of support, programs of setting up the effective wards, of scaling up the ICU units and breaking out of storage the 4,000 ventilators that we have in the system. Most importantly of all, I'm concerned about our workforce in those areas. Intensive care specialists do not grow on trees. They have been working over the last 18, 20 months now, incredible hours, as indeed our whole healthcare professionals and healthcare workforce have. They are tired and they are still committed to getting through this process. The best thing we can do to support them in that projected increase is to keep that projected increase as low as possible, but also to have the best support, the best systems and the safest systems that make sure that they can do their job safely.
Minister, on cases linked to known outbreaks, there's only 107 today. Should we get used to seeing that number shrink, and will it shrink dramatically?
So what tends to happen is as the contact tracers, who are still getting on top of each and every case, that number will come down over the next day or two. We've seen that consistently over the last 5 weeks as those numbers of unlinked cases starts out big but comes down. Having said that, the more cases there are and the higher the number of unlinked cases, the number of overall unlinked cases continues to be a major concern for us. That's why, again, testing and vaccinations are so important as the mechanism that will help us flatten out that.
The Premier didn't seem too shocked by the numbers this morning, but I have to ask, have we opened the doors to regional too soon, do you think, given these numbers are surging? We closed regional when the numbers were double digits, so...
No, the public health advice clearly had projections as to what was looking like the growing number of cases in metropolitan Melbourne. But at the same time, we've seen higher levels of vaccinations in our regions. We've seen, as the case in Shepparton twice now, and Mildura, Colac, there's a deeper sense of ownership and engagement in regional communities with their health services than, it's not to say that there isn't such a level of engagement in the city, but it's deeper in the regions, and there is this sense of proprietorial ownership and support for their public health efforts. We see it in the higher levels of vaccinations as one example at the moment. We're confident on the public health advice that the very measured changes that will come in tonight are proportionate, but it's up to all of us, particularly our regional communities, to safeguard that by following those rules, making sure that only permitted workers and for permitted reasons travel from metropolitan Melbourne to the regions and vice versa. That's the way these hard-won changes can be built on over time.
The Premier foreshadowed yesterday that it's likely in regional Victoria from now on that if there are sort of specific areas where there's an outbreak, there might be localised lockdowns. What kinds of case numbers, and I guess it would go to nature of case numbers as well, would you need to see in a specific area of regional Victoria for that area to go back into lockdown?
Well, Rachel, it would all depend, as you've heard us from this podium many times, depend on not just the number of cases, but the stories behind the cases. At-risk communities, number of exposure sites, were they in quarantining, were they in isolation, have they been interstate, all of these kind of measures. So it's impossible to give a blanket one-size-fits-all approach to that question. It would depend on the circumstances at hand, and all of that, of course, is increasingly through the lens of increasingly high vaccination levels. So the higher those vaccination levels, the more certainty and confidence the public health team have about the cautious steps to measured reopening.
We've spoken to a few pubs in regional areas who say 10 people indoors, it's not worth opening. What's your response to that? Could it be a little bit more, do you think?
Well, we follow the public health advice, and we understand that the focus of this set of measures, as cautious as they are, is hopefully a first step, but there are much stronger incentives to go outdoors. And as we move into the warmer weather, whether it's in hospitality or education, or frankly any walk of life, the more we can do outdoors, the more opportunities there are for us to safely reopen.
Minister, given the high vaccination numbers and the fact that many regional LGAs don't have any cases, what's the difference between gyms and cafes again being open? It seems
What's the difference between?
With gyms still being closed, but hospitality being reopened. I know you've previously said it is more transmissible in those areas, but there are vaccinations now, so.
We take the advice of the public health teams, and there is plenty of evidence, both here and in New South Wales, that when it comes to Delta, gyms are riskier environments. There will be a time, I'm sure, when vaccination levels get us to that point where they are less risky. It's the nature of the exertion, as we've said plenty of times. We have great deal of sympathy and empathy for the gym operators. We know it's tough. It's tough on so many small business and other business operators. But what we have to do is what is safe and sustainable to build up the capacity of the community to reopen safely, whilst at the same time together with the Commonwealth, supporting those businesses to get through what is some really, really challenging times.
Minister, when are we going?
I beg pardon?
Given the loosening of restrictions tomorrow in regional Victoria, are you considering any changes to the border bubble arrangement?
Beyond what I just announced previously around healthcare workers and freight workers being further tested, further vaccinated, we've got nothing to announce. We announced some changes last week, further constricting the size and the activities that can go on within the border bubble. Having said that, the best way to protect and hopefully further free up that is for the border bubble to remain as virus-free as it possibly can, and to get those vaccination levels up as fast as we possibly can.
Minister, are you bracing for any resistance from truckies when it comes to the vaccine mandate there to get into Victoria?
Look, we understand that all industries want to have, particularly critical industries like freight and logistics, want to have and need to have access across all the state jurisdictional boundaries. But it needs to be done safely and in a sustainable way. As we've seen, the extreme risk zone that particularly Sydney and New South Wales has really, really high levels of transmission. And we've seen it in Queensland, in Western Australia, in South Australia, and several cases in Victoria, where unfortunately those interstate truck movements have all had change of transmission traced back to largely southwest Sydney. And we need to make sure that as we support those important logistics and freight industries to continue to operate, they feed us, they keep us clothed, they're critical industries, but it's got to be done safely. And we've been, as of other states, have been in active discussions with people for some time, and we're just giving notice now that as of the 23rd, that those measures will need to see at least a single dose for freight drivers. Given the increasing high levels of vaccinations around the community more broadly, we think that's a sensible additional tool in our public health toolkit, but one that will also keep that industry safe and operating.
Minister, Victorians are hungry for dates, and we don't have any to look forward to apart from the September 23rd estimate. When are we going to reach that 70% one-dose target? Is it going to be in 10 days?
Well, the more that we get vaccinated, the sooner we get there. So there is, when we set that benchmark, it looked like the 23rd of September. There's every prospect that we will get there earlier, and that's a great reflection on the fact that Victorians want to get vaccinated. What's holding us back sometimes is a lack of vaccines and a disproportionate underrepresentation of primary healthcare and GPs and pharmacies being the locations to get vaccinated. The more vaccines we get, the more locations we have that people can get vaccinated, the sooner we'll not just get to 70% single dose, the sooner we'll get to 70% double dose and 80% double dose. That will give us even more opportunities to roll out what the Victorian version of the national plan looks like.
Minister, just on vaccines, obviously we know it took Australia almost 5 months to sign a deal when we were first approached by Pfizer. Minister Hunt's been out today defending the government's handling of the situation. Do you think the federal minister should have acted sooner, and would we have been in a different position now had Hunt have held that meeting earlier?
Look, I think many Australians were surprised to see the material that was released yesterday. Clearly, what has happened can't be undone. This is a race. It was always a race. And the fact that it would appear that a leading mRNA vaccine provider put forward a proposition that wasn't accepted by government, I guess, is disappointing. We can't undo what has been done. What we can do is get our hands on as much vaccinations that we're entitled to, vaccines that we're entitled to, and get them into the arms of Victorians as quickly as we can, as safely as we can, and deliver on our version of the national plan really, really soon. That's our goal. There are particular focuses and particular risks in those areas in the north and the west that are under the state average on the vaccines, and that's playing out in infections. Those vaccines, if we had have had them and had have been in the arms of people in the north and west by now, who knows where we might have been. You know, I wish we had them. I wish I had last week's Tats Lotto numbers as well. I don't. We've just got to get on and deal with what we've got and get those vaccines into people's arms, get people tested, support communities in the best possible way we can, and deliver on our version of the national plan as soon as we can.
Minister, there's an elderly couple in New South Wales who say they'll be homeless from Monday after being denied an exemption to come into Victoria despite the need to relocate for cancer treatment. Is that the sort of case that could be reviewed by the Health Department?
So the exemptions team consider all the applications that are put to them. I'm not familiar with this particular case. In regards to people who are seeking treatment in Victoria, that's one of the criteria. But then equally, there are sometimes issues about has that treatment been available and been provided in New South Wales? Are there other reasons why people might want to return beyond that are less? Every case is important. Every case is in people's minds critical. But when it comes to critical medical treatment, end-of-life care, end-of-life visits, those are the ones that are prioritised, and reluctantly that means some people get the answers that they're not looking for. Having said that, the measures we took yesterday and are now being rolled out to get the first tranche of those people, particularly along the northern side of the Murray River home, as quickly as possible, are underway. And as we've indicated, there will be further steps of implementing the National Cabinet's decision about home-based quarantine for those wider groups, which are many, many thousands of people, as soon as we possibly can. The overriding measure is to do that safely. When we look at the numbers of infections in New South Wales, even though we've got clearly increasing transmissions ourselves, the numbers in New South Wales are significantly higher, and we have to appropriately factor that in. And I apologise to the many people that causes discomfort for, but we have to put the provision of protecting Victorians from further incursions of Delta coronavirus from New South Wales at the forefront of all we do.
If I could just go back to that 70% single dose target and how it went from September 23 and now we're looking at September 18 or 19, does that not prove that once you give Victorians an incentive to go and get vaccinated, they'll go and do it? And should we be offering other incentives to some people that still are a little bit hesitant?
Well, the last issue, what that shows is that Victorians aren't that hesitant. Increasingly, they're wanting to look for vaccines. And what it shows is perhaps not so much, there might be an element of incentivising people to come forward and do things, but equally the measures that have been announced regarding freeing up international travel, the measures that have been announced about location-based areas where you can be when you are vaccinated, you can re-engage in commercial life, in social life, in cultural life. All of these things form part of the real incentive to get out there and get vaccinated. But more fundamentally, the motivation of looking after yourself and your family and protecting those you love, given the increasing levels of infection in the community, that's the most important incentive to go out there and get vaccinated.
So you're confident there's enough incentives already in place as it is?
No, we wouldn't rule out adding to the list of incentives all the time. And we're talking to lots of businesses and lots of organisations about what that looks like. The critical thing that governments can play in that space is having the systems in place that firstly get as many people as vaccinated as possible, but then the foolproof systems, the fair systems that can demonstrate who is and who isn't vaccinated, so as to essentially have a vaccinated economy, a vaccinated cultural life, a vaccinated world operating for those who can demonstrate that they are fully and safely vaccinated.
Can we just ask some questions of Professor Cowie, please?
Ben?
Yes, please. Professor, how comparable is the situation in Melbourne's north to the situation in Sydney's southwest?
So there are certainly features in common. Generally a younger population, so people who have not been previously eligible for vaccination under the sort of national rollout, which understandably and necessarily prioritised older people. Also a significant proportion of people who are essential workers, so as a consequence are moving around and participating in the economy, and that puts them at greater risk of exposure to COVID-19 compared to someone who's able to work from home. There are also, as has been referred to previously, in some circumstances, particularly amongst cases we're seeing, larger household sizes. So if there's one person who gets COVID, that consequentially exposes a significant number. And I think there's also so there's a range of factors, both sort of cultural, social, and in terms of their sort of housing size, etc., that relate to a lot of that. Picking up on what Minister Foley said previously, because the initial general practice rollout of vaccine was weighted towards areas where a greater proportion of the population were aged over 60 or 70 years, that does mean that there's less general practices involved in vaccine rollout in younger areas of Melbourne, such as the North and West. So again, reflecting what Minister Foley was saying, we urgently need to get more general practices involved and more doses into general practices in those regions, because we do hear very strongly from community. Many of them want to discuss their vaccination with their trusted GP, and they want that practice to be the place that they get vaccinated.
Just on that, we saw hesitancy last year in these groups coming forward to get vaccinated. Do you think we've overcome this hurdle? Is it purely a supply thing? And I mean, currently we've got, 48% of people in Hume receiving one dose and only 26% rather, are fully vaccinated.
Yes. So again, I think there certainly is different levels of hesitancy in different communities of Melbourne. We see that by age group, we see that by sex, and we also see it for some cultural and linguistic groups. That is absolutely the case. By far and away, the biggest barrier to vaccination at the moment is not hesitancy, it's access. And access is really underpinned by the number of doses available. 81,000 Victorians made appointments to get vaccinated yesterday. That is suggesting strongly that there is huge appetite out there for vaccination. And there was a community forum with members of the northern and western suburbs communities last night where very strongly the message was, we do need information about vaccines. We do need to provide that in appropriate ways for the community. But by far and away, what we want is more availability to get vaccinated. And that's what Minister Foley was reflecting on, and that's the mission.
We had an exposure site earlier in the week that I understand was some sort of medical clinic that was offering ivermectin to its customers or clients. What would you say to anyone who thinks that ivermectin is the solution to COVID? And I guess what response do you have to the fact that, that medical professionals were reportedly offering this?
So I can't speak to particular cases. Ivermectin, which is an anti-parasitic drug, has no role in the treatment of COVID-19. It has no evidence behind its use. And I would strongly encourage any person who's considering whether they might have COVID, get a test and then let our healthcare system look after you. Because we have drugs that work for COVID. Ivermectin is not one of them.
All good? Sorry. Can I just get one more, Professor Cowie? Sorry. I just want to... No, Professor. Sorry, it just relates to something.
Thank you.
Home quarantine. Could we start thinking about home quarantine rather than hotel quarantine for double vaxxed people quite soon, given the proportional risk in the community is much less than a hotel leg? When can we start thinking about that?
Sure. So as the Minister reflected, we're continuously reviewing a whole lot of public health settings around what might change with people who have 2 doses of vaccine. A Case in point is reviewing the furlough criteria for healthcare workers, which is underway, because we've seen, really fortunately, some of those healthcare exposures that have been reported in recent weeks result in nowhere near the sort of secondary transmissions we saw last year. That's partly due to fantastic use of PPE and plentiful PPE, but it's also due to the fact that those staff were vaccinated. So you're right, those sort of provisions around home quarantine or need for isolation or duration of isolation, that's the subject of national discussions at the moment, looking at what can we change for doubly vaccinated people. It's all part of that roadmap. So those measures are coming, but they're under national discussion at the moment.
Thank you.
Thanks, everyone. Thank you, guys.
Pardon?
Thank you, Andy.